Take a look at this map. Every dot you see here represents a pharmacy that closed just last year. Thousands of locations gone. In 2024, 186 pharmacies closed just here in New York. And the ones still open, CVS, Walgreens, well, walk inside and it's not exactly what it used to be. You may find half-stocked aisles, empty shelves, and all sorts of everyday items locked up. But this isn't just happening here. Drugstores are closing in every corner of America. In certain parts of the country, mostly rural America, the nearest pharmacy could be over an hour away, leaving many Americans in what's being called a pharmacy desert. Just look at all the closures. Think about it. Pharmacies or drugstores, whatever you want to call them, used to be a one-stop shop for almost everything you needed. Now, large chains like CVS and Walgreens are struggling, and smaller, independent mom-and-pop pharmacies can't afford to stay open. So what's going on here? Are we witnessing the death of the American drugstore in real time? Not long ago, it felt like the retail pharmacy giants dominated every corner, but the pharmacy landscape is clearly changing. From 2005 to about 2014, CVS and Walgreens opened thousands of stores nationwide. At their peak, they were thriving. In 2014, Walgreens made about $49 billion in prescription revenue alone, and CVS wasn't far behind. But the good times didn't last. In the last 6 years, nearly 7,000 pharmacies have closed nationwide.
That's about 4% of all pharmacy locations in the United States.
Remember that map I showed you? Benjamin, who's a pharmacist himself, crunched those numbers.
10 pharmacies are closing every day.
Walgreens reported a loss of $8.6 billion in 2024. And I cannot even fathom that. And they say about a third of their 8,700 stores weren't profitable last year. The company suspended the quarterly dividend it's paid to its shareholders for the past 92 years. And Rite Aid filed for bankruptcy in 2023 due to mounting debt, declining revenue, and costly opioid settlements. Through some financial restructuring, the company emerged from bankruptcy last year, but who knows if it'll ever be the same. But for CVS, it's a bit of a different story. The company is better positioned than its competitors for two big reasons, but we'll get to those in a second. What you need to know now is that over the past decade, both companies have experienced significant dips in their stock values. So what's led to all of this? One aspect is that most of the stuff you see here at the front of the store isn't bringing in as much money as it used to. And it makes sense. Shopping habits have changed. Almost everything is more expensive at a CVS or Walgreens than it is on Amazon or Walmart. So aside from needing something in a pinch, why would anyone choose to shop for everyday items at a pharmacy when things are much more expensive? And even grabbing a simple item like toothpaste can mean hunting down an employee to unlock it. Someone even posted a picture of this can of Spam locked in a case at a Duane Reade. Who the is stealing Spam? Years ago, these chains started to blame theft for their loss of profits, which resulted in more and more products being locked up. A few years later, they admitted that those numbers were overinflated and that they overreacted, but now products are still locked up, and studies have shown that people don't want to wait around to have a stick of deodorant unlocked. CVS is experimenting with letting customers use an app to unlock items, but it might be too little too late. The industry is also facing a staffing crisis, both behind and in front of the pharmacy counter. Locations are operating with skeleton crews, and there are reports of walkouts and burnout. So customers aren't happy, the staff isn't happy, these companies aren't happy either because the front of store items aren't bringing in as much money, overhead costs are increasing, and profit margins have thinned out across the board. But what about here, behind the pharmacy counter, where these companies have always made most of their money? Well, it turns out that this part is struggling too. But why? It doesn't make sense. America is the land of pharmaceutical abundance. Enter pharmacy benefit managers. PBMs had humble beginnings. The first were started by pharmacists. They would process pharmacy claims, reimburse, and negotiate lower prices from drug manufacturers. Fast forward to today, and PBMs have transformed. Look, I could spend hours telling you about the nuanced ways that PBMs work, and it would be incredibly boring and confusing. All you really need to know is that just like any other good money-making entity in healthcare, through vertical and horizontal integration, along with a lack of regulation, they've become powerful profit-seeking middlemen with strong bargaining power to negotiate drug prices between manufacturers, insurers, and pharmacies. Basically, the entire supply chain. So how does this specifically affect pharmacies? PBMs, like the name says, manage the pharmacy benefit, and they've managed it into the ground. The fact that benefit is in the name is just good branding. The more PBMs reduce rebates for pharmacies and increase fees, the more they keep for themselves. And we're talking billions in profits. In fact, there's no incentive for them to actually bring costs down. They benefit more from higher drug prices, which leaves patients having to spend more and pharmacies getting little to no profit in a lot of the prescriptions they fill.
It's very similar to going to Las Vegas. Most of the time, you're going to lose money and the house always wins.
So profit margins are shrinking in the part of the store they've always banked on. This has definitely hurt places like Walgreens, but it's eviscerated mom and pop independent pharmacies across the country. The top 4 PBMs control about 70% of the market. Remember that vertical integration I mentioned earlier? Express Scripts is owned by insurance company Cigna, OptumRx is owned by United Healthcare, and Prime Therapeutics is owned by 19 different Blue Cross and Blue Shield plans. But then there's Caremark, the largest PBM in the country, whose real name is, reveal yourself, CVS Caremark. Aha! CVS bought Caremark in 2007 for $21 billion. It's the only PBM owned by a pharmacy company.
They might make a decent chunk on their Caremark business, but that's not all of their business. It's not even half.
Several years ago, they bought an insurance company named Aetna, a big swing that cost CVS $69 billion. And so now, CVS owns the largest PBM in the country, CVS Caremark, and the 3rd largest private insurance company, Aetna. That vertical and horizontal integration puts CVS in a better spot than its competitors, who are getting absolutely destroyed by these PBMs. CVS can just be a loss leader for CVS Health. And they can use their different entities to take advantage of the unique set of assets that they've cobbled together. The company beat estimates in its last earnings report, and as a result saw a 15% spike on its stock price. Walgreens, on the other hand, is completely susceptible to that PBM bargaining power that I mentioned earlier. But they have also jumped on the acquisition bandwagon. Walgreens owns Duane Reade, Boots, which are pharmacies in the UK, along with pharmacies in Mexico. The company also has a 40% stake in the largest pharmacy chain in China. It also owns some beauty brands and VillageMD, a chain of urgent care centers Walgreens bought for $6 billion. But VillageMD hasn't worked out for them so far, and they're apparently considering selling it off. All of these investments and acquisitions are in an effort to diversify and keep profits at a certain place, not in an effort to keep retail pharmacy locations open, nor give Americans access to essential healthcare.
The actual pharmacy that is talking to people, giving people their medicines, giving people their vaccines, becomes the redheaded stepchild that gets ignored and gets a fraction of the budget of the other divisions.
For CVS Health, after so many successful acquisitions, the pharmacy is now its weak link. There were reports that the company is even considering a breakup of its healthcare and retail operations. CVS is also leaning heavily into its healthcare services to counterbalance the decline in retail pharmacy. And the company just announced they'll be opening smaller stores that only have pharmacies. And Walgreens just agreed to a $10 billion deal with Sycamore Partners that will take the company that's been public for almost 100 years private, making them less beholden to the share price and hopefully reviving the company. There's also increased competition, with Amazon opening more same-day delivery pharmacies, and Walmart, who can now ship same-day prescriptions nationwide. So what does this all mean for you and me? If these big-name pharmacies can't pick themselves back up, it won't just be a loss of convenience, but more seriously, loss of access to essential healthcare for many Americans, especially those who live in rural or low-income neighborhoods. There's a real human cost to all of this.
Access to pharmacies is really positively correlated with life expectancy, quality of life. When pharmacies close, people die.
Some states have put legislation in to combat PBMs, but the state level can only do so much. There are talks about PBM reform at the federal level. Trump has said he wants to knock out the middleman. There were rumblings of this in his first term, and it never really happened. But there is growing bipartisan support of PBM regulation and reform. Will it happen and will it make a difference? Let's hope so. But only time will tell if legislative support can help these chains survive. And unless these companies can figure out more ways to become adaptable, don't be surprised if we see more pharmacies closing.